I've had a lot of patients recently reach out to me. They're having trouble sleeping all of a sudden.
Hmm.
We've been playing around with their hormones, trying to dial it in, get the right amounts, progesterone, estrogen, testosterone. And so I've had just a lot of feedback. I'm not sleeping well. All of a sudden I'm up between like 1 and 3 in the morning. I've had other people reach out to me to tell me that they all of a sudden start having diarrhea. They think it's their GLP-1. I was like, no, 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 people. Especially in the Northwest, we start getting pollen starts kicking up around the beginning of March, right?
Yeah.
And so, yeah, it is. It's terrible. When your body responds to histamine, that histamine response is very agitating. And so it actually really kicks up your immune system, and your immune system is really active overnight. And so that can be really stimulating at nighttime. So your heart rate can increase, and all of a sudden you're awake for no reason. You don't know why it's happening. So that's commonly what's going on. Obviously, I can't just say that without talking to the person, and we have to go through all the process of looking at all the variables. But
Right.
that's a real common thing. And it makes you tired. Like
Yeah.
I'm tired. Like
Yep.
I have significant allergies. I take quercetin daily, which really helps. So quercetin is a natural supplement that it prevents histamine from being released in your system versus like an antihistamine, which just blocks the action of histamine.
Hmm.
So quercetin can help, but it does. You are tired from pollen, and it's your body having an immune reaction.
Yeah.
So it's not necessarily, it could be your hormones, but it also could be right now, at least in the Northwest, pollen. And then for GLP-1 use, so the thing about the diarrhea, most people have with GLP-1s, the most common complaint with GI complaint is nausea or constipation. So when you all of a sudden start having loose stools, when you think about what happens to your body when you have an allergic reaction, so you get really snotty, you get really phlegmy. So basically the mucous membrane from your nose to your butthole is the
Yeah.
same thing, right?
Whole track.
The whole track is the same thing. So when you think about all of that phlegm, all that mucus in your sinuses and your throat, that's happening in your digestive tract. And when that happens, then it makes everything slip out a little easier.
Yeah.
So it could be that pollen is playing a role in that too. So not necessarily your GLP-1 could be,
Yeah.
but it also could be allergies.
Well, especially if it just kind of like pops up out of nowhere and you've been
Yeah,
on a GLP-1 for months or years.
exactly.
Usually that's not going to happen. Allergies are
Exactly.
And I've had the same thing where I'm waking up every morning, like work, I'll look at the clock and I'm like, okay, yep, it's 3 o'clock.
Yeah.
Just awake for no
Yeah.
reason and then right back to sleep.
Yeah.
Same like congestion. I need to take quercetin because
Twice a
I'm
day.
not.
It helps. I forgot it yesterday morning, and
Yeah.
yesterday I felt more congested than I
Yeah.
did. So,
It's really bad right now.
yep. We hosted a screening of the M Factor.
Yeah.
That was really fun. So we did that at Lincoln Theater.
Yep.
On the 22nd, there's a live streaming of the M Factor. Be sure to look for that. I should have had the details
On
actually.
PBS,
I think
right?
it's on PBS.
Yeah.
Yep. And so the filmmakers are streaming that for everyone to view. So if you missed it with us or anywhere else, you could view it on the 22nd. Details to come. We'll post something about that.
Yeah.
But that was really fun.
It was fun. It was really informative and it was nice to have just the open conversation and different perspectives and points of view.
Yep.
It was really, I think it was helpful for a lot of people. And it
Yeah.
was just fun to be around other women who have experienced the same things or
Yep.
have the same questions or have guidance, different guidance or different
Yeah.
ideas of what, perimenopause and menopause looks like. So
Yep.
it was really good.
It was a good set of panelists from different
Yeah.
backgrounds. We had a PharmD, we had a naturopath, myself, and then we had a licensed mental health counselor or professional. And so that was really great perspective.
Yep.
So everyone answered some questions, just kind of contemplated themes in the movie, which was really great. And I think that I don't know. I mean, obviously menopause is having a moment
Mhm.
right now. And I even in our practice, I have seen a lot more women come to me or who have been coming to me. And then all of a sudden they say, okay, my primary care is going to take over my hormones. Yeah, that's great. That's
Yeah.
great. And so I think that the difference between how we approach hormones and how your primary care or your GYN is going to approach hormones is really different, right?
Yeah.
So you can get hormones fairly easily, right? So topical for systemic, vaginal, testosterone, progesterone. But the difference is in what we do is we look at how does your body process those hormones, and
Right.
your body processes them different than I do,
Mhm.
than the person next to us, right? So we look at that. And so one of the ways we look at that is through genetics. So we look at your genetics to understand what is the roadmap of how your body processes pretty much everything. So, for example, if you and I were to, we'll say let's say we have a couple ladies that are 50 years old.
Yeah.
They weigh the same amount. They haven't had their menstrual cycle for a year. They're totally menopausal. And we give them hormones. Let's say we do their blood work first. And their blood work says, okay, 30 pgmls of estrogen in your blood.
Yep.
And then I give them a patch, same dose. If I measure them 6 weeks later, they could have the same levels of estrogen in their system, but one could say, oh my gosh, like my boobs hurt.
Yeah.
My nipples are tender. I'm super cranky. I just feel bloated. And the other lady could be like, yeah, I don't feel anything. Like, I'm still having hot flashes. Yeah, I just don't think it's working. Right. But in their blood, we can see that maybe they have the same level still.
Yeah.
So the difference is the metabolites, right? So our body detoxifies our hormones, whether we make them naturally ourselves or we're given them externally through hormone replacement. So it goes through different phases of detoxification. So the first phase of detox so let's talk about estrogen. So estrogen it's circulating in your body. Let's say it goes to wherever it's going to go. It binds to a receptor site. Receptor takes it in, takes the message, spits the estrogen back out, does whatever it's going to do. And then estrogen, if it still has a signal, will circulate in the body. It'll do the same thing again. Now, if it doesn't have a great signal or it's time for it to die, it goes back. We'll simplify it. It goes back to the liver. And so in the liver, it goes through phase 1 detoxification. So this is where estrogen goes and it'll say, okay, we're going to give you a tag. And so I'm talking really fast.
It's a lot of information and visualization.
I'm thirsty now.
My mouth is dry.
Okay, so phase 1 detox. So estrogen goes back to the liver. It gets a tag. So basically, it changes or alters the personality of your estrogen. So it's no longer estrogen. Now it's a metabolite. So it's either 2-OH, 4-OH, or 16-OH. So it changes the personality, basically subdues them in some ways, but not in others. And then they're supposed to get in line and go to phase 2. So while they're waiting in line, they can suddenly slip out of the liver and go back out into the system. So 2-OH is kind of benign. She's not going to cause any problems. 4-OH is very radical. So she's going to float around. She's going to cause problems like inflammation, oxidative damage. And then 16-OH, she's going to make her way down to your uterus and she's going to proliferate. So she's going to cause things to grow, right? So that's what they do. So if they leave the liver prematurely before they've been completely detoxified, then they can cause problems. And that's the piece where I see, of course, primary care, GYNs are probably not looking at that. And the only way you can find that out is by doing a saliva test, doing a urine test, or looking at your genetics and understanding what potentially could happen. So 2-OH, fine. 4-OH and 16-OH, a little bit more problematic. So eventually they get back in line and then they're waiting in line. So the second phase of detoxification, they're basically given luggage. They're carrying this luggage. This luggage is basically a combination of different cofactors and enzymes, and they make their way down to the GI tract. When they're in the GI tract, bacteria can knock off the luggage and they can suddenly become radical again, and then they can circulate through your body, causing all these problems. And that happens when you have poor gut function. Either you have constipation or you have some GI dysbiosis, and so you just don't have the right combination of bacteria. And so that's why so for example, if you have PCOS or endometriosis and you have really poor gut function, or genetically your body favors making one type of metabolite, or your body doesn't make enough cofactors, so that's why protein is so important, then you're more likely to have these metabolites that cause problems. And if you have endometriosis, it's going to cause more lesions to grow. It's going to cause more shedding. You're going to have more inflammation in your body. So that is why it's so important, and why functional providers and integrative providers really kind of harp on are you pooping? What's your poop like?
So important.
How much fiber are you eating? So, and that's because you want your drain to work. Otherwise, you can have these problems where maybe you do phase 1 pretty well, but then your phase 2 detox is slow, and then you have this backup. And so rather than those metabolites just slipping out, now they're kind of forced out because there's no place for them to go. So it's super important when you're doing hormone replacement therapy, if you want the best results, to make sure that you're working with a provider who looks at those things and not just giving you the hormones. And also, people get frustrated and they don't want to continue because they're not seeing the results, or they're like, okay, my boobs hurt all the time. This is not worth it to me. So
is fine tuning. It's not just lab work and giving you a certain prescription or patch or pill or pellet or whatever.
Exactly.
Every body is different.
And that's also too why we have frequent visits to
Mhm.
fine tune that.
Yeah.
And every 4 to 6 weeks, as we adjust things, as we figure out how your body, because it takes a while for those metabolites to accumulate
Mhm.
and to cause the side effects that we might be looking for to adjust that.
Yeah.
Obviously, testing is, I mean, that's really why I encourage everyone to do a genetic test or do a
Mhm.
Dutch study, because it gives us that information up front.
Mhm.
And so then there's less guessing down the road.
Yeah, because when you change something, you can look at it's like you said, the genetic test
Yeah.
doesn't change. It's always going to be the same.
Yeah.
So,
Like I know that you need choline, or I
yeah.
know that you need more protein, or maybe
Yeah.
and a lot of the protein that we need is just the amino acids.
Mhm.
Those amino acids are used to build enzymes and cofactors. And so
Yeah.
if you don't, that's why one of the reasons why, if you look at any menopause influencer, they're like protein, protein, protein. And that is one of the reasons why. And I don't even know that most people, even the influencers, know why.
Yeah, they
But
know that they should say that.
yeah, right. So protein is important. Obviously, it's the building blocks in our body. So
Yeah.
we definitely need it, especially when we're trying to maintain lean muscle mass. But
Mhm.
more than that, we need those amino
Yeah,
acids.
such good information.
Yeah.
Another thing, talking about the menopause screening, is the podcast that
Yeah.
we listen to.
Yeah.
I think that you should tell.
Tell the world
Yeah,
about Mel Robbins and Rachel Rubin.
like jaw dropping,
Yeah.
one of the best podcasts I've
Yeah.
ever, just so full of information.
Yeah.
And if it's not affecting like me or someone I know,
Yeah.
it's somebody out there.
Yeah.
It was just so, 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 so enlightening.
Yeah.
Yeah, it was great.
So it's Mel Robbins, and she has Rachel Rubin as a guest. So I have devoured all things menopause for the
Yeah.
last 4 years, and I mean from people who are just basically what I consider like a talk show host
Mhm.
or a guru or an influencer to
Yeah.
MDs to just various different everybody.
Hmm.
And so I've devoured that. And when I heard, so actually one of my patients told me about this. She's like, you got to listen to this, and I was like, okay, because I had prescribed some DHEA
Yeah.
vaginally,
Hmm.
which is amazing. And she was like,
Yeah.
"Oh yeah, that's like super helping me." Also, did you watch the podcast? And I was like, or listen to the podcast? And I said no. So I listened to it, and I was like, "Oh my gosh!" So when we screened the M factor, I like put it out there for everybody that was there to listen to. And it's funny
Yeah.
because my daughter,
Oh,
she
yeah.
breastfed her kids. So she has two kids pretty close together. So all told, she breastfed for about 4 years.
Yeah.
And even though I know what happens to your body when you breastfeed, I didn't put the
Yeah.
two and two together that basically you're in menopause. And
Yeah.
I was like, what? And my daughter, she was so in Tennessee, she was telling me, she's like, I was listening to this, and the whole time I was like, oh my gosh, I can't, why? Why?
And every postpartum woman
Yeah.
feels that way. Like what's the brain fog, the not sleeping, the mood swings.
Yes.
And we're like, oh, we're tired. We just had a baby.
Yeah.
It's our hormones going all crazy out of whack. This is normal. But it's
Yep.
basically you're in menopause.
And then when you stop breastfeeding, there's
Yeah.
still the postpartum period after that, because it's not like your body goes, oh, you're done. Okay, back to normal.
Right.
No, it takes time.
Yeah.
Yeah.
That
So,
was just crazy. And
yeah.
I was like, what?
Yep.
Everybody needs to know.
Super.
Yeah. Yeah. There was a lot of good information. It's what, a 2.5 hour
Yeah.
long
It's a longer
podcast, but
one.
it's worth the listen. I think I broke it up over a couple of
Yeah.
days because I would listen to it throughout the day, but it was every time I listened, I was like, give me more information.
Yeah.
And like,
And it's peppered with
so,
science, but it's also really easy for a person who's
yeah.
not sciencey
Yep.
to understand and like get a lot out of
Yeah.
it.
I think it was the beginning of when the podcast came out.
Mhm.
So it's one of her more recent ones.
Yep.
So you just have to look for the one with
Rachel
with
Rubin,
Rachel Rubin.
Mel Robbins. Yep.
So good.
They didn't pay for this.
Oh. The entire time I was listening to it, though, I was like, oh my God, I wish I could share it, because there's no way to share like to a story
Yep.
or a post. You have to screen.
If you were to watch, because they have it on YouTube as
Oh.
well, so we could have it on YouTube and have
Yeah.
it in the background and be like, listen to this.
Yeah.
Yeah.
They screenshot it.
Social media is a full-time job.
Yeah. I was like,
Nobody
I
wants to
want
do.
people to listen to it. It was so good. Like even men.
How many times did you go out for dinner this week?
So my birthday is April 14th.
It's like a national holiday.
It is for all my family, and I'd like it to be for my friends too. Most of them it is, but I'm still one of these people that loves my birthday and loves celebrating it, and it never gets old. I always look forward to it. Maybe someday I won't care anymore, but right now I still care.
Do you expect like
No, I don't know. Nothing happens in the morning. I just wake up to like texts and messages and stuff like that, and that's nice.
yeah.
But
Do you like, oh, everyone loves me?
well, I'm like, I'm taking note. Who's texted me first?
Yes. At what time?
No, I'm not. No.
I didn't text you first because I knew that you'd be sleeping in.
That doesn't matter. No, I was actually up
Okay.
on my birthday. So I'm finishing my clinicals
Yep.
for my degree. So I worked with hospice on my birthday. So it was nice, but I was kind of distracted too. Like, it's my birthday. Just we went out to dinner on my birthday, and then for some reason my husband likes to steal my birthday. His birthday is the day after mine. I'm pretty sure he did that on purpose. And so we went out on his birthday, and then I had a friend visiting over the weekend.
Yep.
So we went out with her a couple times. So yeah, this whole week was
So how is that playing into your health and fitness
horribly
goals?
not. You shouldn't have a week.
Yeah, before that you were on vacation.
No, well, we were on vacation the end of March.
Okay.
So yeah, we got back and we started our meal prepping. I got back to my workouts, and then birthday week hit, and yeah, it's been eating out.
Well, cheers to your birthday month.
I'm glad it's over. No, I'm just kidding. I love my birthday. Yeah, it was fun though. And thank you everyone for all the happy birthday wishes and all the
Honoring you.
yeah, thank you.
Whole
Just
day.
taking the time to say happy birthday. That means so much.
Yeah.
From my favorite person ever. So beautiful. I love them. They smell great. We have an event coming up.
Why don't we just call it a party? Because ultimately that's what people want and kind of how we treat it.
Yeah, it's basically just a nice event for people who have either are new patients of ours or have been patients of ours for years. And it's just a nice kind of social hour.
Really, it's just drinking and
Social
eating
hour.
and talking
Yeah.
about aesthetics.
Yeah. And
Yeah.
also functional health.
That's
all
true.
that. Yeah. Yeah. But it's nice to show appreciation
Yes.
for clients, for new patients, old patients, anybody who just wants to come and learn a little bit more. We will have an educational series to the evening. So we'll do a probably 15-minute ish presentation on an educational piece focused both on aesthetics and functional health and how the two work together. There's just oh
Yeah, because a lot of times when we have patients come in just for their, we're very much we have a lot of time
yeah.
to meet with our patients and they may have more questions, just more
Mhm.
casual conversations that they want to have. Maybe they're not interested in a particular product or service in that moment with you, but then they're interested in all these other things and they also want to see. So a lot of our patients, we have some of your results with some of your patients are so incredible. And so we have a few key patients that will hopefully will be there and then everyone can ask them about their process
Yep.
and how they, what their goals were going in and, where they're at now.
Yeah.
And some pretty major results.
Yeah. And it is. And these, kudos to these patients for trusting me. Number one, thank you. Like that's huge for trusting the process. And then just kind of following the treatment steps and the protocols and stacking treatments. That was one thing that we were going to talk about is treatment stacking.
Yep.
It's really hard to get maximum results with just one treatment. It really is. It's
Botox
almost
doesn't fix everything.
Botox does not fix everything. I wish it did. But it doesn't,
Yeah.
and that's just one step in the entire process from skincare to in-office treatments, facial, injectables. It's just a whole range of things. Everybody's different and needs different customized, treatments, of course, but it's never one and done. And I say this to my patients all the time. Telling them next year at this time, if you follow the treatment plan and we do all the things that we're talking about doing, you'll be happier with your skin and you'll look more refreshed and you'll look like yourself again or what you perceive yourself to look like or how you should look. And so yeah, and it's gradual. It's not going to look like you came in one day and had all this work done.
Yeah.
You're going to look refreshed. You're going to look rejuvenated. You're going to feel good. And it takes time. And I also tell them too that it's not you don't go to the gym and just work out your bicep and expect your entire body to have a makeover. And it's the same thing with injectable treatments and resurfacing treatments. Each treatment works on a different level and does a different thing for your skin. So it's just it takes time and it takes effort. And I wish it was one and done, but it's just not.
Yeah.
It's not.
Well, and it's like so to your point,
Mhm.
it builds on it. So
Yeah.
so a lot of times, so we both obviously we're on social media. We follow
Yeah.
people on social media. We have some fitness people we
Mhm.
follow,
Yeah.
and I always look. There's one Kim French who I really like to
Mm.
follow. So she's beautiful. Oh my God.
Yeah.
So you look at her before and after pictures, and people will say, "Oh, well, how do I achieve that?" And she's like, "Girl, it's taken me 6 years
Years.
to get here." And that's what, and especially as you're older,
Yeah.
it takes longer.
Yeah.
So, I mean, the difference, the results between somebody who's 25 who
Right.
maybe just has a lip flip and some
Yep.
filler compared to somebody who's 48 that's like, okay, now I got to do all this stuff. There's a big difference between that. So,
There
having
is.
realistic
Yep.
expectations, and I think that's part of our education process here is tempering people's expectations that you are not necessarily, sometimes it is drastic.
It is. Yeah.
Like every time I get Dysport in my jaw, it lifts it up. I'm like, oh, thank God.
Yeah.
But then, there are other things like sculpture that
Yep.
takes time to build. And when you look, even myself, when I look back at some of the photos from years ago,
Yeah.
before I had sculpture and a little bit of filler,
Uh-huh.
like people will ask me, like, what did you do?
Yeah.
One, I lost some weight, but it's really, I haven't done a lot.
No.
We just timed it right.
Yeah. You've not done a lot. I mean, I think you only probably have 8 syringes of filler in your face,
Yeah.
maybe. Not very, very minimal
Yeah.
compared to what, we could probably do more, just a little
Yeah.
tweaks, but it's not a lot. And
No.
8 syringes sounds like a lot. People freak out when they hear that.
Well, really? There was like
Yeah.
8 of my face.
Yeah, and that's not a lot. Not
Crazy because I was like, wait, what are we? And that was a
Yeah.
while ago too.
was a year and a half, 2 years ago.
Yeah.
So, yeah. So it is, it's just building a plan, which is why I like to do the consultations first.
Yep.
I do have people that will just book online for filler appointments, and which is totally fine, but I like to have that full consultation so I know what your goals are.
Yeah.
So I know how I can treat you appropriately to get best results because
Yeah.
it's not one and done. It's
No.
so tailored.
Yeah.
So and Dysport's always a great place to start because it will change your skin. It will freshen it up. You will feel better and look better, more refreshed, but it's not going to be that's there's more to it.
Yeah.
Skincare is so important.
Yeah.
So important.
The laser. Every time I'm like ready for laser, it's like, dang, I'm going on
Going on
vacation.
vacation.
Or it's, like this, we're kind of in no man's land.
Yeah.
My husband and I go fishing, so there's no way I could go get laser and then be out on the water
No.
fishing with the sun and the reflection.
No.
So I'm like, okay, I guess I gotta wait till September,
Yeah.
unfortunately.
Probably. Yeah.
Yeah.
Unless you stay off the boat for a few weeks, for about a month.
Yeah. No.
That's probably not happening. Fall will be here, and then again, and it's going to be microneedling and then laser and all the things that we can't do in the summer. And
Yeah.
usually by fall, our skin is damaged from the sun and being outside and, UV damage and just
Yeah.
the heat. So it's time for that refresh in the fall.
Yep.
Our event, we're calling it Sip and Smooth. So we will have wine, charcuterie, just some good yummy. We have an event coming up on May 29th, Sip and Smooth.
Yes. Is it always going to be called sipping something?
Yeah, because we're basically sipping and having
The next thing, sipping.
because we are having,
People aren't sipping; they're drinking.
well, whatever. They can drink.
Okay.
Down it. Have fun.
Something like, why don't we call it gulping something?
There you go.
We'll have a party for GLPs where nobody eats anything,
Yeah.
drinks anything,
That's perfect.
and we just give out Zopran.
Yeah, not even rice cakes.
Little trays of Tums.
Yeah,
Yeah.
enjoy.
Yeah.
Again, please.
That would be actually a really inexpensive event to
It
host.
was.
Yep. Okay. So sip and sculpt. No, sip and smooth.
Mhm.
Okay.
May 29th, 5 to 7. So,
Okay.
yep, just a short little kind of like happy hour window on a Friday night. Come hang out and ask questions.
I need to know what the masses really want.
What do you want? Tell us. Do you have questions that you want us to talk about? Like leave a comment, send us a message. We were going to talk about Dysport and dosage with Dysport and how it changes over time.
Yes.
So you had mentioned you started getting Botox in your 30s.
Yep.
And kind of took a little break for about 8 years or so.
Yep.
And then started getting Botox again in your 40s
Yep.
and had a dose. And when you first started doing it, you thought you could go a lot longer, like
Yeah.
years.
Yeah.
Without.
2 years was the first time I got Botox. I was like, I was good for 2 years.
Yep. And then in your 40s, you're starting to notice Botox probably won't work on you anymore or be as effective, but Dysport's a little bit more effective for you and lasts longer.
Yep.
So it's aging. It's just our body ages.
Yes.
The way you respond to the Dysport will change over time, even though, even when you're consistent with your treatments, whatever's happening in your body and your hormones and your skin is going to
Yeah.
change how your body metabolizes the Dysport and how effective it is.
So I have a perfect
Yeah.
story that kind of ties into how we react to Dysport and how. So when we, thank you, sir. So when you repeatedly eat something
Hmm.
that you are sensitive to,
Yeah.
after a while you become desensitized to it.
Hmm.
So for example, I found out that I was really sensitive to eggs. I ate eggs all the time, so I mean, obviously stuff was going on, but I kind of ignored it, and I just did had. I was like, I ate it all the time.
Yeah.
I did elimination and
Mhm.
I added eggs back in and it destroyed me.
Yeah.
So it's kind of like the similar thing with Dysport is you've been
Yeah.
using it over and over, so your body just gets used to it. It
Mhm.
becomes less sensitized to it. So if you take a break, potentially can you become more sensitive to it?
Not necessarily. And like I said, it depends on your body. So if you're losing collagen, if you're perimenopause or in menopause, that collagen loss is happening.
Yep.
So the Dysport, you may need to adjust your dose a little bit.
Yeah.
Your skin is aging. Everything underneath your skin is aging. So, fat pads are separating, ligaments are stretching out,
Yep.
your bone is recessing. All of this is happening, and you see it on the surface because of how your skin changes, but
Yeah.
it changes the way treatments work on you too.
Pulling underneath
Yeah.
is breaking.
Yeah, so it's super important to, if you have to adjust a dose and increase it, that doesn't mean that it's not working anymore. It just means that there may be some changes going on in your body where you have to adjust it for that time, or maybe, this is how it's going to be for the next few years. But things that can help with that.
Yes.
Number one, medical grade skincare,
Mhm.
important. Doing collagen stimulating treatments, making sure you're using products that stimulate collagen, vitamin,
Okay.
zinc. I don't know where that went. Zinc helps with longevity of Dysport treatments. So you can take zinc over the counter and then, reducing other stressors, reducing inflammation, avoiding the sun, staying out of those UV rays that breaks down collagen and all the fibers so quickly.
Mhm.
I know we want to be tan and have that glow, but it really is damaging your skin more than you think. And, it's hard to reverse that process once it's started. So avoid those kind of things. Avoid alcohol, make sure you're sleeping. I know all of the things, exercising, healthy habits, and that's also going to help. So it's not just age and my Dysport's not lasting as long anymore or something has changed.
It's your lifestyle.
Yeah, it is everything.
Yeah.
It is
Genetics. Yeah.
all of it. So
And we find, and you find, and I see this too, because I have patients who have autoimmune conditions. And so even if you have relatively stable autoimmune, like a Hashimoto's so common, so it's an autoimmune thyroiditis. And in those patients, they burn through their Dysport or their Botox, whatever neurotoxin they're using so fast.
yeah, and that's another thing too. People with faster metabolisms, people who exercise all the time or they sweat all the time, or doing
So if I stop
sauna.
exercising, my
No,
Dysport will last.
keep exercising, but avoiding exercise, strenuous exercise, especially in that first 24 to 48 hours is really important to make sure that you're making sure that your dose is effective and that your treatment is effective. You're paying for this. So if you want the best results,
Follow the rules.
yes.
Yeah.
This is your money that's
Mhm.
going into your face. It's protect your investment.
Yeah.
So, yeah,
Exactly.
so those are some things that can help. But we're going to age. We're going to lose collagen. We're going to,
Basically, we're like 90 because we wear hats and sunscreen on our face, but the rest of our body is going to be saggy and brown.
well, that's where plastic surgery comes in.
That's why we do what we do.
Yeah.
Later.
Sure. Dr. Dry might be making a phone call. No.
Like our CO2 laser,
Yeah.
you can see that it changes the skin.
Mhm.
But as far as the things that like, underneath the surface tighten things up, I have
That's hard too. Yeah.
yeah.
I mean, collagen stimulation will
Yeah.
tighten skin up, but it depends on how lax the skin is.
Yeah. And how much of it there is.
Good.
On your face, that makes sense. On your abdomen and your thighs, that's a big area with a lot of structure that needs to be addressed. Yeah.
We're going to try it.
Go to
Melt
machine.
my abdomen. Find those abs that are hidden in there. I know
You can see your abs.
some days. Quercetin. I need to take my quercetin.
Works really well, actually.
All right. What else?
I think that's it. We can talk about nocturnal tumescence. Do you know what it is? So a nocturnal tumescence, something about vampires. No, it's the morning erection is nocturnal tumescence.
That
So that's one of the first signs of cardiovascular issues is like that loss of nocturnal tumescence.
Yeah.
So
Morning wood.
morning wood. Yeah, it's a sign of health.
Yeah.
Yeah.
It is.
Yeah.
Which some men don't know that. What's wrong with my body? Yeah. You probably need to get your heart checked.
Exactly. Is your blood pressure high? Then
Yeah.
you may not have boners anymore. Exactly why you need to check your blood pressure so you don't lose your boner.
Yes.
Well, good for you.
I don't want it to go away.
So set to chart that nocturnal tumescence declining.
That's a fun thing to chart.
Yep. It's a lot of words, a lot of letters.
Describe. I had a patient today. I love her so much. And she came in. She doesn't live here, but she comes back and forth
Yep.
to see me.
Uh-huh.
Like literally. Well,
Yep.
and her daughter too.
The truth comes out.
But she walked in and she was like, "You are the cutest thing about Anacortes ever." And I'm like,
That's adorable.
Yeah.
Nice.
She's a ramp.
I love people who like just like put it out there. They don't hold back. They
Yeah.
aren't afraid to compliment people or just say what
Yeah.
they're
Oh.
just kind hearted.
It's nice.
Yeah.
It's nice. It's nice to have people who are happy to see you and want to
Yeah.
see you and that they're excited to see you.
Yeah.
It feels good.
Yeah. Yeah. I don't think people are as excited to see me as they are to see you.
That's not true.
People enjoy what they get from me
Yeah.
and they feel so much better.
Yep.
But it's not like they're slapping down their dollars and then they walk out looking different, right? So
But they feel
they
different.
do, but not instantaneous. They gotta wait for their prescriptions.
Well, you have to wait for the Dysport to kick.
It's true.
There's
But
not-
somehow you feel I get a pep in my step after I get Dysport,
Yeah.
even though you can't see it
Mhm.
right away.
You know.
Yeah, you're like,
Yeah.
yeah, I'm gonna be glowing.
Yeah. I know.
Yeah.
Or in like 24 hours.
Yeah.
People. Yeah.
No, my patients are like, nope. Okay, I'll go to the pharmacy to pick up my thing and I'll talk to you in a couple weeks.
And hopefully it'll start.
Yeah, and then it's a text message and I'm like, how you doing? Yeah.
They do get excited to see, but I get
For sure.
excited to see them too. It's fun.
Yeah.
I have most of all my patients I love seeing on a regular basis. And I love hearing the updates on your lives too. That's like the best part of my
Yeah.
day with my patients because they, I don't see them for 3, 4, 6 months, sometimes once a year.
Yeah.
And so many things happen in that time.
Uh-huh.
This happened and, just updates in life.
So when you get your NP, maybe you should get the psych NP.
Nope.
Okay. Because you're
Always
doing that already, pretty much.
much. Yeah.
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 I'm listening.
Yeah.
That's
Also, your patients tend to gossip more than my patients.
Yeah. It's fun. It's like a hairdresser. Like you go to your hairdresser or your nail person and
Yeah.
you just, you're like, all right, well, what's going on?
What needs? What's the word on?
Yeah. Nothing ever goes outside of my room. Just
Yes.
trust me on that.
I try, but she doesn't tell me.
Nope. This is a locked door, closed like a ball.
Yeah, I can hear you guys like giggling and laughing. And I'm over here. I'm trying to
Chart.
I'm trying to chart. I'm trying to just
I can see you with your goggles on, start pounding on my wall. Shut up.
You see my glasses are gone?
No. Because when I think of geneticists, I think they're like the lab people.
Oh, it's science.
Yeah, like
Not my progressive lenses.
put your goggles on. You're reading the DNA.
With the gloves on.
Yeah.
Yes, that's
Yeah.
what I'm doing.
Cracking and cackling
Yes.
away.
Having a good old time.
Yeah. That's okay. But I do cause my patients a lot more pain than you do,
This is true.
sadly.
Well, some of my procedures, so I have to use lidocaine for some of the pelleting, and that is, I mean, all of the pelleting is lidocaine, not just some. It's not selective.
Everybody gets like,
Yeah, that's painful. I see a lot of booties.
I do remember that about,
Yeah,
don't miss it.
you don't miss the booties. I've seen a lot of just because I was a massage therapist, and so
Oh, yeah.
always working the glutes, so
Yeah.
tens of thousands.